As you know, our brains are hardwired towards the negative, um, but we can rewire our brains too, and we can create new patterns. But it's just something that requires a practice.
Hi, everyone. Welcome back to the channel. Thanks for being here. Today, I am interviewing Dr. Nadia Sarwar. She is a board certified pediatrician. She is also board certified in palliative care. Today, we're going to talk about a really fascinating subject, clinical hypnosis, which is actually pretty new to my knowledge base as well. I have very, very little knowledge on what clinical hypnosis is and what it's used for. So I'm really excited to dive into this conversation and get to know her opinion as an expert who is currently practicing this. Thanks, Dr. Sarwar, for being here.
Thank you, Saya. I'm really happy to be here.
So let's get into it. What is clinical hypnosis?
Yeah, so clinical hypnosis is a mind-body technique. And like you, I didn't hear about it in medical school or residency. So it was entirely new to me several years ago when I first discovered clinical hypnosis. And the way that I like to describe it is a mind-body technique similar to meditation, but also different from meditation in certain ways. So whereas meditation is about clearing the mind and being in the moment, clinical hypnosis is about replacing the negative thought patterns in our mind with more positive ones. I tell my younger patients it's kind of like daydreaming on purpose in order to feel better.
And so how is it done?
Yeah, great question. Well, the process that I go through with patients is first I start by working on the words that they use. And then we shift to the thought patterns and the imagery. So hypnosis is really about words and imagery. And so we start with finding the negative words that patients are using to talk to themselves inwardly, and replacing them with more positive self-talk. And then the next step is to work on the imagery and create more positive imagery. One of my favorite forms of hypnosis that I teach both kids and adults is special place hypnosis. And it would sound a lot like guided imagery, or like if you've ever done a guided meditation. But the difference is you get to be really creative and really personal. So I work with the patients to create a special place that they would feel most relaxed and happy with, and to find the imagery that's going to help them most with what they're struggling with. And so the way that it works is that they imagine themselves in that place with all their senses. And as they do that, they can start to feel more relaxed. And we can also work on symptoms that they may be struggling with during the process.
So what would you do for someone like me? Because as I'm hearing this, I'm thinking this sounds great, but I would probably benefit from something like this because I do have pretty high levels of anxiety, and I was doing my research for this interview, and I know that clinical hypnosis is one of the techniques that can help anxiety. But when I hear you saying all this and like teaching myself to talk more positively about myself, because I would say traditionally pretty hard on myself, talking about myself positively doesn't necessarily mean that I actually believe some of the things that I'm saying. So is that a common barrier you have to work through with some patients?
Absolutely. And I have sort of an exercise and a demonstration that I do with them to illustrate this. But the bottom line is that using negative words is going to have an effect on how you feel, both mentally and then even physically. And I tell patients they never want to lie to themselves. So if they're feeling like something is really difficult, they don't want to say, "Oh, this is super easy." Or if you hate math, you don't want to say, "I love math." That's not going to work. Your brain is going to reject that. But you can say things like, "I wish this felt easier. I wish I could understand this math problem. I wish I could feel more calm about this." And with time, you start to notice that when you change the words that you're using for yourself, it does feel a little looser, a little lighter. And as you know, our brains are hardwired towards the negative, um, but we can rewire our brains too, and we can create new patterns. But it's just something that requires a practice.
And how do you become trained in clinical hypnosis? What's the process?
Yeah, great question. So I was lucky enough to find a mentor who is a what we call a clinical consultant, which means that he had certified and practiced for over 20 years. And so he taught me. I shadowed him, and there's also a training that you can go through with two certifying bodies, one of which is the American Society for Clinical Hypnosis. And then for pediatrics, the National Pediatric Hypnosis Training Institute, or NIFTY. And that is where I attended both trainings, but I completed my certification at NIFTY. Yeah.
Nifty is the pediatric one.
Yeah, the pediatric one.
And how long is that certification and what does it look like after you're done? Like, do you still practice general pediatrics or have you kind of completely moved over into this field?
So I have completely moved over into this field, but there are plenty of people that continue as pediatricians or gastroenterologists, psychologists, psychiatrists that also use this as one of their many tools. So in terms of the training, it's attending a certain number of conferences, but then also using hypnosis in your practice for a certain number of hours over a period of 2 years. And then the final level of training looks like sort of recorded patient interactions and then going through it with a mentor at NIFTY and getting their feedback.
So let's talk a little bit about the evidence that exists to support clinical hypnosis. In what fields do you feel like the evidence is strongest to support it? And what else can be done to kind of explore this a little bit more?
Yeah, absolutely. So there's the most evidence is actually, I would say, in the field of anesthesia. And that's a big group of physicians that we do train at NIFTY end up being anesthesiologists because the data has shown, conclusively that anesthesia, the needs for anesthesia are less when a patient gets preoperative hypnosis, and also that the need for pain medications is far less when hypnosis is provided alongside pain management. So I would say that's the greatest deal of research. The other field where there's quite a bit of research is in the GI field, where patients with IBS have had improvement and even resolution of their symptoms, and with the use of hypnosis in combination with other treatments.
I had also been looking things up before this, and I noticed that I couldn't really find a true landmark study surrounding this. Can you comment a little bit about where do you think this field is going and what can be done to sort of bring it more to the forefront?
Yeah, actually, so I have joined NIFTY, the National Pediatric Hypnosis Training Institute, as a junior faculty now. I call myself a junior faculty. I mean, as faculty now, and my group of younger physicians that have just joined. This is a lot of what we talk about is how to create more research in the field. So I feel like hypnosis got a bad rap for a long time, and some of the previous generations that have kept using hypnosis in their practice have not been super focused on the research side of it, and that's something that we would like to work on, and that's one of my goals.
So that brings me to my next question. Can anyone be certified with NIFTY, or does it have to be a physician or a nurse? What is like the prerequisite degree required to actually go through the training?
Yeah, so NIFTY requires that you have a clinical background. So when the conferences are attended by physicians, psychologists, and psychiatrists are probably the greatest number of people that attend, but also nurses and clinical social workers. And I want to say dentists. So those are among the different people that can certify in clinical hypnosis.
So if someone is going through, let's say, clinical hypnosis, you had mentioned pre and post-op. So that's obviously sort of a very defined period of time. But if someone like myself decided to try it for anxiety, what
Mhm.
does that journey typically look like? Is that like 10 sessions, 20 sessions, and then it goes down? Is it every week? Is it every month? Like, what's the frequency, duration? How does that play into different disease states?
That's a great question, and thank you for sharing that. So the process, it really depends on the patient, of course, but I would say in terms of how quickly you might notice a difference, many times it's even after the first session. But I tell patients usually within the first 3 to 4, they should feel a difference and improvement in their symptoms. So typically, I would say give it at least 6 sessions. And some of my patients that may come in with something like a tic disorder, where it's just sort of one issue and there's not a lot of underlying anxiety, it may just take 6 sessions and it's gone. I had a patient with a habit cough where it literally was 2 sessions, and this cough that they've been struggling with for months was gone. So it can be really amazingly quick in its results. But for some patients, when they've struggled, what I'll tell people is if they've struggled with something for a long, long time, then to be patient with it as it resolves.
So what's interesting is my dad actually, he has so a lot of my anxiety surrounds flying, and it has obviously impacted me in terms of like going places and things like that. And so my dad actually has a fear of flying, and I'm not really sure if him just telling me about it has impacted my fear of flying. But anyway, would that be something that like prior to a flight, something I would have to do like before I get on a plane? Or do you think that it would be something that I could slowly wean off of?
That's a great question. So hypnosis is actually really great for phobias. So for something like fear of flying, it may just be something that you require a couple of sessions before your next trip and could be really helpful. I also want to make clear that the hypnosis that I teach is all self-hypnosis. And what that means is, yeah, I help you create this experience for yourself, but then you take it home and practice it. So it would be a skill that you would hopefully practice at home and then practice on your own before your plane ride and then also on the airplane. And so it can be really, really helpful for phobia related to flying. And certainly I do sometimes provide like a recording of my voice if a patient asks for it, but most times that's not even required, and patients prefer to just practice it in their own minds on their own time.
Do you feel like resistance is a reason for treatment failure? Because I'm totally calling out my dad here. So I think he listens to these. So
Yeah,
hopefully he's
yeah,
not mad about this. But he's like, no, I tried hypnosis. It didn't work, blah, blah. But he's also like very resistant.
mhm,
So like, I feel like you have to go in with like an open mind and the willingness to believe that it
yeah,
might work.
that it
Uh,
could work. Yeah,
do you feel like that's,
absolutely.
yeah.
Absolutely. So that would probably be the number one reason for hypnosis not working for a person is if they come in with sort of preconceived notions, and and that's okay. That's I can understand where that might come from. Sometimes within the first session or two, there people are able to let go of those preconceived notions. Like if I can help you feel the result, then that's super powerful. And it's also something a lot of people do because, hey, it's worth a shot, and it doesn't have any side effects. It's rarely the first place that a person comes to, you know? It's usually, oh my gosh, I've tried so many things and I've been to so many specialists and okay, this is worth a shot. And then it can be, yeah, so the resistance, which is what we were talking about. And I see that a lot in kids, actually. I see it more in kids than in my adult patients. Because as an adult patient, if you sought me out, it was your choice and you must, kind of have some idea that it could work. But sometimes kids are sort of dragged in by their parents. And so I like to clarify right in the beginning, sort of like, how willing were you to come to this appointment?
Hi, everyone. If you've enjoyed this interview thus far, be sure to hit the like and subscribe button below. It not only helps the channel, but helps out all the people that we interview. Thanks for watching. So one thing you mentioned, which is really interesting, is that, there's really no side effects. And I really like that because obviously a lot of drugs that we use do have some side effects, and anything that we put into our body may not have just, treating the symptom that we're trying to treat, and might also do other things. So it is one of those things where people could try it, but certainly it's going to take time, which a lot of people don't like. So because it has no side effects, to me, that seems like, oh, this is great. Everyone should be talking about this. Why is this like the first time that I've heard about it? in a real way. Like, of course, I've heard about like being hypnotized, but I was kind of like, oh, that's not like real. Like, that's just, something that happens at a magic show. Like, why has this not been like kind of more popularized?
That's a great question. I think a lot of it has to do with the negative connotation that people attach with hypnosis. And that's been something that, if you look back historically, when physicians were accused of they think of hypnotizing as somebody having power over you. And that is something that gives people pause. It also was at one point, I think, used by law enforcement. And that led to some sort of negative repercussions as well. So for a lot of reasons, and the media included, and stage hypnosis included, people think of it, I think, as a loss of control. And so that's something that I work to help people realize is that the hypnosis, as I describe it, clinical hypnosis, is never sleep, it's never mind control. I'm not going to make you quack like a duck or do anything silly like that. And I tell people, yeah, it is about mind control. It's about you being more in control of your own mind. Because how often are we just not in control of what's happening in our minds? And so a lot of what I do is building awareness and just creating the possibility that there's a choice and that things can shift if you decide that you're ready to shift. Yeah, so I think that to answer your question, I think that a lot of people have practiced hypnosis kind of like even without saying they're practicing hypnosis. I talked to another physician recently and I reached out to her and I said, what you do sounds really interesting. It sounds like hypnosis. And she said, yes, I'm trained in hypnosis, but she doesn't post it anywhere on her website. And, she calls it subconscious coaching, which is what is a lot of what we do. Because once you get past a person's anxiety and calm their minds, you can get through to that part of us that's really calm and knowing and wise. And then we can give that part of you suggestions for health, well-being, control of anxiety, and other such things. So that's a powerful part about what we do in clinical hypnosis that we haven't gotten to yet, which is the suggestions that we can offer.
And are those suggestions offered like during the session or is it after the session?
It can be either. So it can either be in the person's hypnotic experience. We might offer suggestions such as, if you're on the beach, then you can put all your symptoms into a beautiful sand castle and watch the waves take it away gradually. We can offer suggestions of being more and more able to be in control of your mind, of your body, and those sorts of things are more able to settle in a person when they're in that calm state. So, but they can also be offered after the session because patients tend to be in a receptive state after they've just practiced hypnosis.
So I think I may have practiced it without knowing it because when I had these like ruminating thoughts about like anxious flying or after I had my first baby, I had like, all the anxious thoughts
Mm.
about everything. And I was given a suggestion to like imagine a stop sign and to just like to stop all those thoughts and just to redirect my energy and redirect my attention somewhere else. And it did work, but it was, again, it's like it was more conscious. It wasn't subconscious for me. It was very like stop thinking about these awful things that are very unlikely to happen to you,
Yeah.
your child. So what's your thought process on what I just said?
Yeah, that was hypnosis. So I
Oh,
wonder who taught you that because we do use that technique.
okay. So yeah.
Okay. So there's techniques out there that we may not be naming as clinical hypnosis. Honestly, also like a guided meditation, that's hypnosis. When you're imagining a different place, imagining yourself in a different place, imagining sensations, that's all hypnosis.
So now here's the $1 million question. Is this covered by insurance?
Yeah, that is a great question. Unfortunately, no. And we find, some physicians have found ways to incorporate hypnosis into their practice. And so you can find physicians who might be pediatricians or internists or specialists who are certified in clinical hypnosis through the two institutions that I mentioned. And they may, as part of their practice, do some clinical hypnosis, in which case it can be covered by insurance. But for actual dedicated appointments where we're doing clinical hypnosis, no, it wouldn't be. And so the way these physicians manage it is they bill it as counseling time. So, that's sort of how they get around. But even so, in my last practice where we build insurance, the insurance companies are becoming really resistant and are starting to push back and limit the amount of time we can spend with our patients and things like that. So, in creating my own practice, I do my best to make it affordable, but also create a environment where I can give my patient that full hour and the time that they need and have the time that I need in order to chart and think about them and sort of create a plan for them.
You know, what's interesting is, as you mentioned that, I'm thinking about something like anxiety and imagining if the insurance companies could actually just reduce anxiety overall through methods like meditation, hypnosis. And for some people that need that extra help, like I cannot meditate on my own. And, everyone's like, yes, you can. I'm telling you, I can. I tried it. I just I decide not to do it, frankly. Um, but I think I could actually participate in this where someone's almost holding me accountable. It's kind of like having a personal trainer for your mind, right? Like it's harder for me to go to the gym, but if I have a personal trainer and I've paid for it, I'm like, I'm showing up to the gym to get my workout in because I've already, committed the money. Like this could potentially reduce costs overall if we're talking about reducing pain medication, reducing anxiety medication. It could actually reduce costs for the insurance company when you really look at it from a long-term perspective. Has that ever been like brought up when it comes to insurance discussions or anything like that? Do you know what the stance is or the current practice is in terms of like dealing with insurance and lobbying for better coverage?
So you bring up a really good point, and this is actually something that, again, I'm just starting out in my career here, but this is something that I definitely would want to work on in my career is lobbying for coverage for mental health in general.
Mhm.
Because so many diseases that we know of are linked to stress and anxiety. And yeah, it could save a lot. Think about all these kids that become adults with, hypertension and other medical problems that we know are linked to long-term stress. So yeah, so my stance is I wish hypnosis was taught in schools. So that's another thing that I want to do is reach out to schools and teachers and make this a bigger focus, which I think the focus is shifting. As a country, I think we have to pay more attention to mental health now, especially after the pandemic and what kids have been through. So, so to answer your question, yes, yes, like all of that. And so, I have all those hopes, and let's see how far we get.
Is clinical hypnosis useful for ADHD in children?
So it can be helpful mostly to treat the anxiety related with ADHD. So I do have some patients that have many patients actually that have ADHD or may have dyslexia. And or even patients that are on the spectrum, and which are all three very different disorders, but I'm grouping them together because while clinical hypnosis won't necessarily help with the dyslexia or help with the ADHD, it can help with the anxiety and sort of the shame that comes up for patients that have those diagnoses.
And you mentioned treating children. So what is like an appropriate age to start clinical hypnosis if this is something that someone watching wanted to try for their child?
Yeah, so in general, I say 5 and up. I have had an occasional 4-year-old patient who just has like an amazing attention span where I've been surprised that they've been able to engage. but 5 and up. And the way that clinical hypnosis works is just different at every age. So at 5 years old, it's more storytelling and play based. And then the peak age of hypnotizability is somewhere around 11 or 12 years of age, which means they're most amenable to using their imagination, and they're still kind of like open. As you can imagine, as kids get older, sometimes they become less open to these techniques.
And then does that curve ever change? Because you say that the adults that come see you tend to be more open, or is that just a case by case scenario?
I would say it's case by case. Just in my anecdotal experience, I've noticed that women tend to be more amenable and open to hypnosis. I believe women have a great imagination, and but too often what we're imagining is all the negative scenarios.
Yes.
Um, so yeah, in my experience, often when I was teaching hypnosis to a child, I would see their mother also drift away and go to her own special place, and that smile when they came back.
Mhm.
And sometimes it was almost like the shift seemed greater in the parent than in the child, which is
Yeah.
part of what led me to wanting to work with moms.
So I want to circle back to cost,
Yeah.
because it's not covered by insurance. So if someone were to see someone like you or similar, someone who's maybe in their area, what can people expect to pay out of pocket, for one session?
Yeah, I think the cost can vary, but I would say somewhere in the range of 250 to 350 for a 1 hour appointment is what you could kind of expect. I have a sliding scale, so I will try to accommodate patients who can't afford my rate, which is also part of why I wanted to do my own thing is, the insurances that will cover for doctor's visits, for prolonged doctor's visits are PPOs. So in my state, Medi-Cal wouldn't cover for it. And so I want to be able to treat those patients as well that can't necessarily afford the usual office rate.
Okay, awesome. This has been really fascinating. Are there any sort of final thoughts that you want the audience to know about clinical hypnosis?
Yeah. Well, I want to say one thing also. You shared with me that you've had anxiety as a parent, and that's something that I can really deeply relate to. So I do want to say a word about why I'm choosing to shift to treating mothers. And that's that I realized that the biggest impact that I could make for kids was to help their parents. The sooner you can take care of yourself, the sooner you can, I mean, what we want is for our kids to be healthy and happy. And sometimes it's the most impactful thing is to take care of yourself. So about clinical hypnosis, my personal bias is that everyone should try it. And again, I think there's not enough of a focus in our system, in our current healthcare system, on prevention or on treatments that don't involve medications. I'm not anti-medications at all. I'm all for them. But sometimes, the focus needs to be on, whether it's meditation or hypnosis, taking care of yourself, healthy nutrition, all these things need to become more of a focus.
Nadia, thanks so much for being here. This was really, really interesting. What is the best way for anyone watching this or listening? How can they reach you and learn more?
Thanks for asking. Yeah, so my website is mumtawellness.com. That's MUMTA wellness. And you can also follow me on social media on Instagram and Facebook. And you can find me by just looking up Nadia Sarwar, Dr. Nadia Sarwar. Not very imaginative, but that's that's how you can find me. And I would love to hear from any of you. And Saya, I'd be happy to offer you a session anytime you want to try it. Because yeah, I really appreciate you having me, and I think you're gonna like it.
I'm actually 100% going to take you up on that, and I'll talk to you about it offline. And
Yeah, yeah.
if I'm comfortable enough, maybe we'll even record it and put it out in the world for people
Oh,
to
okay. Yeah,
see if we'll see. We'll talk offline. All
we'll
right.
talk.
All right. Thank you so much for being here.